All right, so next we have our very first panel, which is going to be on entrepreneurship. And, oh, sorry, let me grab this. All right, so here we go. So our panel is going to be moderated by Tracy Weatherby, and the remaining panelists will be Molly Lindquist, Carlos Gomez, Tara Thiarajan. I think I pronounced that properly. All right, thank you.
You ready for us?
Yes.
This is like the Johnny Carson show. Very exciting. Yeah, let's put at least one of you down there. Yeah. So what we wanted to do here was just have a brief exploration of a real variety of social enterprises that they've been able to bring together on this panel. So I'm excited about that. I work with the Global Social Benefit Incubator at Santa Clara University as an executive fellow and doing business and impact model content and curriculum for them. And so I get to see a lot of enterprises on a global level go through our accelerator programs. And so I'm very impressed with these guys and what they're doing at the stages that they're at. So what I wanted to do is just briefly let each of our panelists do a 1 to 2 minute kind of what does your company do, how long have you been around, and how big is it, so we get the context. And then we're going to go into some questions about scale and structure and some of those areas. So why don't we start with you, Carlos?
Sure. My name is Carlos Gomez. I'm from Mexico. My company is called Nevia. We're based here in San Francisco. And we are manufacturing and developing our first product that is a shower head that saves 70% of the water. Previously, I was in the gym business, and I was showering 20,000 people a month. and water
that sounds a little racist,
yeah.
But okay.
Not myself, but yeah. And water was my biggest variable cost. So we set up to develop a shower that could really save water, but with a better experience. We think that we have to come up with a product that people really like and want to have and not need to have. And that difference will make it, will set the aspirational basis for our product.
And how long have you been at this, and how big is your company so far?
So I've been at this around 6 years. We submitted the first patent in 2009. But then we hired a CEO in 2013. We moved to San Francisco in 2014, and I moved to the Bay Area in June last year. Okay. And right now we are 8 full-time people inside the company, but we are hiring full-time advisors, another 7 people. So we're around 15 full-time people developing.
Okay, Molly.
Yeah, my name is Molly Lindquist. Good morning, you guys. I'm down here from Portland, Oregon, so when I woke to that orb in the sky, I was like, oh, vitamin D. I am a founder and CEO of a nonprofit organization called Consano, which means to heal in Latin. And Consano is a 501c3 crowdfunding platform for medical research, where researchers can list their projects and people impacted by whatever disease category can donate directly to that project. And this all stemmed from my own diagnosis back about 4 years ago with breast cancer. So I had 2 young daughters. They were 3 and 5 at the time of my diagnosis, and I really came out of my own personal experience very saddened by the fact that they would face this higher risk. And not being a scientist myself, I thought, how can I use my finance and strategic planning background to hopefully help contribute to a world where those 2 girls don't have to worry about breast cancer. So it stemmed from a very personal issue when I couldn't find a solution to what I was looking for. And given the success of Kickstarter, Kiva, other crowdfunding platforms, I thought, why doesn't this exist for medical research? And that was really the impetus behind the organization. So we're just coming up to our 3-year anniversary of the launch of the website at the end of March, and there will likely be cake involved. And we have raised just over $1 million. We've worked with 35 researchers across the country. We have partnerships with 25 academic institutions, and we're kind of at that tipping point of brand recognition, so to speak. So it's been very gratifying from a personal level for me to take a pretty crappy experience because of these two and really turn that into something that can hopefully help others.
And have you done all of this yourself? Are there other employees? How many people are you?
Yeah, so it's an all-volunteer enterprise at this point. So I wear many hats. Yes, and really what we've found, given the mission of the organization to provide this transparency is, for better or worse, for better for our organization, all of us have been touched in some way by a health issue. And so really kind of leveraging that personal connection that people feel to the mission has enabled us to recruit some really amazing, talented people who are willing to volunteer their time and their expertise to help us grow the organization. That being said, we're also at a tipping point with funding, and so we're, the long-term plan is certainly to have a full-time staff to support this. But again, because it's driven from such a personal place, it's really
Been able to avoid that so far.
Yes, exactly.
And Tara, tell us a little bit about your organization.
Hi, so I'm Tara Tyagarajan. So Teach 70 is actually, it's a company based in India, and the mission of the company, and the name when it started in 2 years ago, 70% of the world is offline. I think the numbers have changed a little bit, but the majority of humanity does not have access to the internet, and the goal was really to see in this kind of, for the majority of humanity in the world, where access to teachers is very, you don't have good teachers because they're largely in disaggregated settlements, and also the cost of delivery of anything, when you don't have the internet, is much, much higher and much more difficult. And so the goal behind this was twofold. One is to see can we actually create education and assessment that's effective entirely through the digital medium, not necessarily online, but through video. And the second component was, can we create attractive unit economics for the delivery of education and assessment into these populations? So that's the larger goal of the organization. We've started really actually with adult education largely on entrepreneurship because for two reasons. One is this company comes out of a micro-lending company that I also run. And so, you find that people don't, the need is for something more entrepreneurial in the kind of settlements that they live in. And so, though we're now looking at other K through 12 as well. And we're about, the organization's been around 2 years. I think we've, sort of been building out the product model, the delivery model. We're at about 30, 40 people, and we've trained and certified about 25,000 people so far. So we're still in a experimental phase of bringing that.
Big experimental phase.
Well, so obviously because the populations are very large, but you really in this kind of a circumstance, you're talking about populations that are hard to reach, but also have very low income, and therefore your unit, each hour of education that you deliver is a very, from a revenue perspective, is very, very small. So you have to scale very large.
Just so we can kind of visualize what you're doing, what does your delivery model look like today, just in brief?
So there are a couple, so there is the enrollment of people, because you need to be able to identify who is the person who is actually taking the education. And we're also in a circumstance in India where now there is a unique identification system that has been brought into place, so we can actually biometrically identify people, because not everybody has like a ID card otherwise. So we have a biometric enrollment. We have delivery through the video, which has a facilitator. And I think one of the things we spent a lot of time on is that given that you don't have a teacher, how can you enable participation through the video medium? And if you think back to things like, some of the shows you have for kids when they're age 2 and 3, like Mickey Mouse Clubhouse, and the kids are shouting back to it and stuff like that. So how do you bring these kind of participative thing for adults as well? And then the other part is assessment, which is extremely important. And we're talking about also, when we look at adults, a lot of people are very low literate. So we have two modes that we use. One is a IVR based with voice recognition. and to authenticate you, and then it's all multiple choice questions over the phone. But not everybody is able to handle that very effectively, so we also have this mechanism that we've worked with Microsoft Research in India, well, it's developed by them. And it's this cue card thing where all the people in a class hold up a cue card in response to the answers in a certain orientation, and you can take a picture with your cell phone, and it tells you, who got the answer right, and you get an immediate scoring. And so you can do continuous assessment through the.
But you don't have internet access, so when you're talking about delivering video, is it on DVDs?
Yeah, so it can be, the delivery network it's through DVDs, it's through a laptop, it can be through these projectors on a screen. We actually deliver through franchisees who work in these small areas, and it could be in their living room. They, if they have a TV, they'll, offer it in their living room. They may, project it outside on a wall. Okay. It's all over. Okay. All
Good. Well, you can see we've got a really wide range of organizations here dealing with varying levels of complex issues. But so the next question I wanted to ask each of our panelists was, how have you structured and funded your company to date, and why did you choose that? So are you for-profit, non-profit? Where are you getting your funding from?
Right. We had the first prototypes that we're saving right now 70% of the water, and our first prototypes were saving 85% of the water. So we knew that we had developed something that could really have an impact around the world. And Mexico City is in very high altitude, it's 8,000 feet above sea level, and all the water has to be pumped from somewhere else. So we knew that what we had developed would have an impact around the world, especially in developing countries and other countries in Latin America. So we first started thinking that this had to be a non-for-profit. But then after coming a couple times here to San Francisco and Silicon Valley, we started seeing the virality of certain products that were being purchased by people, and more people wanted to have them, such as Nest and Dropcam and these type of products, and other products that had a little bit more green impact. So then we decided to develop a really beautiful product. We hired a firm here out of San Francisco to do the industrial design, and we decided that if we could develop something that people really wanted, and then we could reach the whole world easier, because with a couple of flagship products we could then develop products at a lower price point, and that way we could reach the whole world. So that's why we decided not to be a non-for-profit and to be a C Corp. And in terms of funding, we did first a convertible note, and we raised some equity like that. Then we did a Kickstarter, and we pre-sold $3.2 million of shower heads.
That's a lot of shower heads.
Yeah, there. And then we opened up our webpage, and we have sold around $1.5 million, so in total $5 million. And
you're not even shipping until
end of this year.
Okay.
Yep.
There you go.
And then we went and raised a round of capital. So in total, with pre-sales, we have raised around 11 million.
Wow.
Yeah.
So all of the people who were pre-selling have pre-purchased and given you the money in advance?
Yes. The people from Kickstarter have.
Yeah.
And the people from our web page have given us their credit card authorization, so we can charge them whenever we want.
Right.
But we're going to charge them in the moment that we have a delivery date set.
Right.
So to set expectations correctly.
Okay, great. And what about you, Molly?
Yeah, so as I mentioned, we're Consano is a 501c3, but that was actually not a super easy decision as we were kind of, envisioning and constructing the business plan for the organization. And I think a lot of that stemmed from the fact that often nonprofits get a bad rap for their business savvy. So my professional background was in finance, and I did a couple years of investment banking. So I was very much thinking of it from, what does any startup have to face? And so, the way Consano is built is with, the same kind of thought behind that. But as we started figuring out, who are our key partners, who are we wanting to collaborate with, and in our case, it's mostly academic research institutes, and we knew that structurally we would have a much easier time creating those partnerships as a 501c3. That being said, we still, answer the same questions about the business that any other startup would answer. I always kind of joke that our ROI, instead of this return on investment, is really a return on impact. And what, by donating to the organization, what are we doing with that money? What's the transparency? And how are we continuing to grow and scale? And again, I loved, John, your slide on the ripple effect, because we very much view our impact in that way. And many times for us, it's one person's story of their illness that then ripples out, and they're rallying their community to do these really great things. And while we're a nonprofit, we still want to scale that and continue to grow that to create as many of those ripples as possible.
Okay, great. And Tara, yours is, I'm going to guess, the most complicated on this.
Not
No?
necessarily so. I think so. The initial seed funding came from the parent company, which is a micro lending company, and then subsequently we raised $1.5 million in a soft loan from an organization called the National Skills Development Corporation in India, which is a public-private partnership where they do sort of quasi-equity, quasi-loan, sort of loan programs with in the education and skill development space. So that's been the that's been the funding that we have.
Is the micro lending? What is the structure of the micro lending corporation? And are you a wholly owned or?
Yeah, it's a subsidiary.
It's a subsidiary, and is
Right
that
now.
a for-profit?
Both are for-profit.
For-profit.
Yes,
Okay,
yes.
but you're still, even in being in a for-profit situation, you're able to raise money through these.
Well, NSDC, which is the where we have the loan from. I mean, their goal is to actually fund this kind of thing, and so.
And it's a loan, not a grant.
It's not a grant. It's not
So
a grant,
you
but
would,
it has
you would probably, with your current structure, have a difficult time taking in grants in some way.
We could take in grants in some way. So one of the things we're actually looking at is, given that, especially when you go to K through 12, the ability for people to pay for education is very limited. And so, we're partnering. In India, you have today 2% of your profits as a company have to go to CSR, and out of that, there's about several billions that people want to put into education. And so a lot of our delivery partners we operate through a nonprofit network who actually then in turn deliver the education and the whole process in the communities that they serve. And so the idea would be that we, going forward, and we're not there yet, but that funding could become a source of revenue to the overall model.
And is the nonprofit network separate from your organization?
Yeah, these are all any nonprofit operating anywhere that has serves a community that we would want to reach. And the idea is unlike.
So how many partnerships have you established?
Well, we've
so
only
far
started we have about 7 or 8 right now in an
Okay.
experimental
Yeah.
mechanism. But unlike this sort of like having a Kickstarter or any online medium, the challenge that you have in this kind of environment is that there is no medium that reaches all the customers that you want. I mean, they're not connected to the internet. They don't consume media in the same way. It's not there, because even newspapers, things like that. So really, you need to tap into these nonprofit networks that are serving certain communities, or you need a lot of feet on street in this kind of a environment. Yeah.
That kind of role. Well, let me stick with you and ask the next question, because I think it tails in well to what you were just saying, which is, what are your future plans to scale? How are you imagining going about that, and how are you imagining funding it? So you've talked a little bit about that. Is there sort of a longer range plan if you look out 3 to 5 years? Are there some other ideas that you're also going to be experimenting with in terms of scaling?
Well, I think right now our focus is on building a platform, the technology platform for scalability. So if we are to, in order to scale, we need to be able to bring on a large number of franchisee partners onto the system for them to be able to, get access to the content, the assessment, and be able to execute that entire process from enrollment to assessment of students. And so, what we're looking at now is we know that our unit economics work pretty well, are attractive from a scalability point of view. The focus in the next year is to get that technology platform ready for scalability, and then at that point we have to take a decision on how fast we want to do that, because here it is really there is a bit of a brute force aspect to it, right? Because you don't have things can't go viral because there is no ability, there's no medium for things to spread in a viral manner. You just have to hire more people.
You have to actually block and tackle and
exactly.
get to every
it's sort of like
village.
Similar to having roll out a chain of restaurants or something. Your restaurant won't go viral unless you get a place and set it up, right? So, that's.
And where does the funding come from? Is it all from the parent company, and where is the parent company getting their funding? And are they applying the same metrics about profitability to your division, or to this education division as to the lending division, or is one kind of viewed as an enabler of the other?
Well, there's always been a bit of debate around that. So the parent company is much, much larger. And it's, right now it's it's sort of like, we'll see what happens with the...
Yeah, we'll see if that thing works out.
See if that thing works out. If it can actually scale. At a rate that makes sense and with economics that makes sense. I think we're pretty excited about the unit economics and the success of the actual the products, and that people are, if you look at before and after, they are learning. There is a lot of the medium works well. So I think it's I think so the parent company has not continued to fund it. It's actually self-sustaining with the loan and the revenue that it generates right now.
Okay.
So in that sense, it's it's doing its own thing, and the question really is how fast you want to scale and how much resources you want to go out and get to do that.
Okay, great. Molly, what are you thinking about growth and future funding? What's kind of the scale-up plan?
Yeah, I think the key words are recurring revenue streams and getting, self-sustaining programs, as Tara was talking about. For us, this has been a very grassroots fundraising effort from an organizational standpoint. So the way that we run Consano, again, with the underlying mission of as much transparency as possible, is that if you come to the website and make a donation to a breast cancer research project, all that money goes to that project. We do not take a percentage like some of the other crowdfunding platforms traditionally do.
And how did you decide not to do that?
So that's a great question. Again, one of a lot of debates and looking at kind of the competitive landscape, and while we're joining a plethora of crowdfunding platforms, so we had a lot of those to compare to. We're in a very different realm where most of our competitors are more traditional disease-specific organizations. So we were, we had these kind of two market analyses to do in terms of what others were doing. And frankly, when I started Consano, the intent, when I was starting to do the due diligence even, it was, okay, what sort of organization can I join forces with? I did not intend to start my own, nonprofit. It was very much, I really want to create this world for my daughters. How do I do that? And I didn't find the level of transparency in a lot of the nonprofits that I looked at. And so for me, that's one of the pillars of our mission, is really providing this transparency and connection to people like me who have been touched by a health issue. So it was actually a pretty easy decision to keep those two things separate, but a much more challenging, exercise in figuring out how do you then create programs that sustain themselves. And so that's been an evolution. And as we've seen, we launched Consano 1.0 with, researchers, and people could come and donate to those projects. Then we launched Consano 2.0, which created an honor fund mechanism where families can actually raise money for research using their stories. And now we're getting ready to launch Consano 3.0, because we've gathered these learnings along the way to provide kind of a matchmaking service for philanthropic strategists at big banks who have clients who are interested in supporting research in these different categories. So I never thought I would pitch Consano as a Match.com, but it's like a Match.com for researchers and donors. Not Tinder, though.
And if you're getting donors that big, now can you take a percentage?
Correct.
Okay.
Correct. And that then feeds this kind of democratized side where people who do not have large sums of money but who can rally their communities can still participate in this philanthropy that, in the past has been very difficult. Because, if you're a researcher, as a patient, I want you in the lab, I want you finding better treatments, I want you curing things, I don't want you writing 5 bazillion grants and emailing every $100 donor to your lab to let them know what's going on. We wanted to make it as streamlined and easy for the researchers as well. So.
Okay, great. So Carlos, I'm going to ask you a slightly different question because it sounds like you've got a lot of money, and so I think we can see a lot of money. We can see the scale that you can get to very quickly. You can tell us more about that, but I'm also very interested in how you will be able to, you've obviously got a very strong social impact, even if you never enter the developing world at all.
Right.
You're saving water's good wherever you do it. But how will you make that business decision to probably forgo some level of profit and move into the developing world? Have you thought through over the next 3 to 5 years, how do you get the business to that point? Do you only do it if you don't forego profit? What is kind of the corporate view on how that fits in? Because I think people can have good intentions about this stuff, and sometimes you're making so much money over here, it's really very hard to go over there so that you can make less money.
Right. So we're a hardware company, and first of all, to develop a product to the level of products that we're all used to, it's very expensive. Mm-hmm. So we've raised a lot of money, but we're also spending a lot of money in developing that first product. And that will happen with subsequent products. Having said so, the more you sell, the more the cheapest on a unitary basis the next product becomes. Mm-hmm. So we really need scale we're all about scale. And when that happens, I think that we can lower the price of our product significantly to go to developing countries. Mm-hmm. We have thought a lot about it, and we sat down with Professor Porter in November last year. And the first thing is that the product itself has an impact.
Yeah.
So the more Nebias that are out there, the better the world is, in a sense. Right? So that's the first part. The second one, it's reserving a portion of the profits and repurposing them. That's something that the founders have talked since day one. We have not put it out there publicly because we have to decide very well what cost to choose and where we can have impact. And there is it related to water? Is it Latin America? Is it wherever water needs? We have talked to water.org and Charity Water. So I think that we need to have those profits first, and then to see what portion and where those profits will have the most impact. But that's certainly an idea that we have in our mind. Yeah.
And one thing I've seen with many of the social entrepreneurs, though, is that if you don't put that stake in the ground really early, you end up with investors who aren't willing to have you give up that percentage towards charity, aren't willing to let you go to that lower cost product. So, one thing to think about is just the positioning to all the people who are investing with you currently. Are they all kind of on board so far?
Yes, to that point, we are a Y Combinator company, so we were on last summer's batch. And we received also funding from Stanford University StartX Fund, and so we're there. But apart from that, all of our investors are individual investors. So when we started fundraising for this round, we got a lot of interest from VCs, but we thought that we could reach the amount that we wanted to raise from individuals and with people that really shared our vision and our values. So we decided not to invite for this round any VCs. It's only family offices, the two institutions that I mentioned, the Schmidt Foundation that I talked to you, and individuals that share our vision. And the idea of that is precisely what you mentioned, not to have right now people that are only looking for profits but are willing to put the social impact there when it's ready to have that conversation. When we're ready to have that conversation.
Oh, that's excellent. Okay. And then our last question, and then we're going to open it up to questions from the audience. So be thinking about what you want to know from these guys, is how have you partnered with existing corporations and nonprofits? And where have you found the trade-offs to be there? So let me start with you, Carlos. We'll move
Sure.
back this way again.
So I was many years in the gym industry. So I had a head start on the health club industry. So our first pilots were in Equinox gyms. And I have been in talks with many of the gym owners from the US and Latin America. And for them, the ROI of our product is between a month and a half. That considering our retail price of $400. So for them, it makes a lot of sense. Then we've talked to a couple of big hotel chains that are very much interested in it. We have been in talks with one of the aircraft manufacturers, one of the two big, that they're coming with showers in their planes. And we have been in talks with cruise companies.
I don't think those are the kind of planes I fly in.
No? Well, the big wants to cross whatever seas. So, and we've piloted in Stanford University, in Apple and in Google. So I think that if we're able to be close to these kind of institutions, the adoption and more people are going to try it, and we're going to be able to start the scaling process early.
Got some real marquee first customers there.
Yes.
And you have to go on their website and see the video about the experience of how fantastic the shower is.
It is true.
It's not just about saving water. Okay.
I love it. So, we kind of, in even developing, the idea for this, knew that we would be partnering with a lot of academic institutions. We actually have set up a vetting process where, the institutions help us, get really innovative, great work onto Consano. So we knew kind of the base of our business was collaborations and was really providing value. So that's how we structured the organization. And then as we've grown and gained credibility, it becomes easier and easier to demonstrate that value proposition to other partners. So we have kind of all these different realms. We have the research community. We have other rare disease specific organizations that we partner with to help raise funds for research in smaller populations, because often there's not pharmaceutical support for those. We haven't had a lot of luck with big disease-specific organizations, mostly because we're still
like
very
the
small.
JDRF and the American Cancer Society.
We're still kind of showing the
Now,
value.
do you want them? How would you like to work with them if you were successful with them?
Yeah, again, because this comes from such a personal, patient-centric place, I want to work with anyone that can help accelerate, this funding that will help us get to better solutions for patients. So in that same vein, I want to partner with any organization that keeps that patient at the center of their mission, and sometimes that's not the case, unfortunately. And the beauty of being small and lean is that you can create relationships that are mutually beneficial in different formats for different organizations. So, I don't know that I can answer directly, maybe for the American Cancer Society, it looks different than for...
This is being recorded.
Yeah, exactly.
We won't answer that.
Exactly. But, I think what we're trying to do is add value. So any collaboration where we can provide, a complementary way of doing things or a more efficient way of doing things, we want to join forces.
Would you want to join forces in allowing them to be a funded entity, or would you like to find a way for them to somehow put some of their funds through you?
Either or. I mean, that again,
Yeah.
it's very much kind of dependent on the
whatever works.
situation. We had a really big partnership win with the National Cancer Institute, actually. And so, as many of you may or may not know, a lot of research projects go unfunded via the NIH. Funding's been really challenging, which is one of the reasons that we created Consano. And so you have these really great researchers who are falling just below the pay line, who then have to turn to other sources of funding. So after many months, actually, over a year of discussions with the NCI, in terms of having access to those researchers that are falling just below the pay line, we finally created a very governmental, legal contract whereby people that fall in a certain percentage under the pay line for specific grants at the NCI get offered the option or opportunity to come to us and raise funds to at least bridge the gap until they can apply again for some of the larger grants. And that, as anyone here who has kind of interacted with the government, was a very long process. And for us, that kind
It's
of
impressive that
was,
you got
yeah,
them
it was
to
kind
say
of a
yes.
gold
So-
star of credibility, where they saw the value in what we were doing. Now,
Yeah.
that being said, they can't, by law endorse what we're doing, but they very much can present people with the knowledge that we exist, which for us is huge. So,
And you should definitely check out Molly's website too if you know anyone who's suffering from anything, because it's not just breast cancer, it's a whole variety of disease issues that are being funded that way. So Tara, tell us about your corporate partnerships or nonprofit partnerships.
Well, I think so far, as I mentioned, we're looking at delivery of the content and the assessment through nonprofit partners. But beyond that, I think there are certainly a number of different kind of collaborations that we would look at going forward, and that we have not done yet. One I already mentioned was with the CSR funding from corporations, and to basically be able to tap into that and sort of bring them in along with the
Just
nonprofit
to
partners.
emphasize this point for people who don't know, CSR is a voluntary thing here, and in India, every company of a certain size has
to
give
have 2%, and that's been only the last 2 years. So it's
yeah. Is it of revenue or of profits?
profits.
Profits. Oh, darn! You can play with that number. All right.
Yeah. Yeah. But the other kind of partnership that we would look at going forward is on content development, because obviously, our original idea when we started was that, there's so much digital content out there that can't we just take it and use it or adapt it in language or, translate. But what we found is that, it doesn't translate as effectively. Because the context for this population, offline population, is so different from what you and I are used to, that you need to do a little, content has to be designed and developed with their circumstance in mind. And it's not just as simple as,
And are you dealing
Hoarding.
with people with any level of literacy as well?
Well, yeah, some people have literacy, but I think, even when you have literacy, like there's a language barrier in terms of, we're also dealing across geographies in India where you have to have your, multiple languages. The other thing is that, for example, the why of why you learn something is so different. So if I'm doing, numerical literacy or, some kind of just basic math, partly people need context for why should I learn this. It's not like, and we've had a lot of this debate. It's not a product that is, education itself is not a product that people are running after like candy and soda. And so it's a harder sell, because also among this community of the 70%, people don't have a positive experience of education in their regular life. So even if they've been to a government school, it's, they haven't had quality teachers, and sort of education is a burdensome means to an end. But also you find in a lot of these communities that they're not, that those who have gone through traditional education are the most likely to be unemployed, because those skills that are taught in a regular curriculum have no application to the environments that they live in. And so you have to think very differently about what kind of content and why, and some of the principles might be the same, but the why of it and how would you use it are very different. And so, partnerships there on content development will sort of help us broaden the scope of what we can deliver.
Okay. So I think we've got some questions from our app. Is that right?
Yes, we do. Thank you, Tracy. And on behalf of the Social Impact Committee and the audience, thank you, Tara, Molly, and Carlos. So I'm going to go through some of the questions. Hopefully, if time allows, we'll go through all of them, but please keep submitting them through the Whova app. So this question is directed to Carlos. Is your social purpose stated in your firm's bylaws? And what did you do to ensure that your firm's social purpose will remain a priority?
The answer first is no, it is not in our bylaws. It is a C Corp, and it is not in our bylaws. And the second question is, how do I make sure?
What did you do to ensure that your firm's social purpose will remain a priority for your firm?
Well, so far the people that manage this company and take all decisions are the three founders, co-founders, and the three of us, for different reasons, are totally aligned that what we want. Me, I was running a public company with 40 gyms, and I decided to come and do this. Philip was working at a non-for-profit in Mexico called Endeavor, that is around the world, but he was in the Mexico chapter, and he previously was doing compostable toilets for third world countries. And Gabe, he was managing a part of the supply chain for the iPhone 6 at Apple, and decided to come here. So I think that the three of us right now are very much vested and have set our values in the company.
Did you ever consider becoming a B Corp?
Yes, we did.
And what were the pros and cons of that for you?
When we started thinking about raising money, we thought that we were going to be more successful as a C Corp at the beginning. Perhaps how things evolved, it would have been the same. But when we came to San Francisco,
it's a very early wave of this, right?
Correct.
Okay.
Right. So the next question is directed to Tara. Are you affiliated with Mark Zuckerberg's efforts in India? And if not, how do you feel about them?
No, we're not affiliated to it. I think, are you talking about the open internet, the limited, is that the question? Well, I think, so the audience, so there are two aspects here. The communities that we serve don't have internet access at all, right? Limited or not limited. And I think, when people put out these statistics of internet access, it's also considered the potential to access the internet. And I think we see, obviously, I think the internet will have huge value for people, but I think that there are still so many barriers to it. For example, language is a huge issue that you find most people don't have, English is spreading, but largely the language of the internet is English, and that's not there. So so that's a more general answer, not to the Mark Zuckerberg's initiative specifically, but I think that it's that's a separate debate on what should you offer and what should be restricted and that sort of thing. And I think it's not directly relevant to the communities that we serve because they can't access any of it at this current time, anyway. So I will, I think that's just a separate issue outside of our audience. Our customer audience, yeah.
Thank you. Molly? How do you measure effectiveness? Attribution?
Yeah, again, I really appreciated John's presentation because it's very much on that middle spectrum. Clearly the direct measurement is what incremental research dollars are we able to raise on our platform that then goes to these academic institutions. However, the more qualitative side of it, which is the side, again, that resonates from my personal experience, is what sort of value are you deriving from the empowerment of individuals who might not otherwise have connection to research that truly matters to them on a personal level, and to feel like they're not alone in their personal health experience. There are all these ancillary benefits of having a place where you can see that others are going through your similar experience. So, again, directly it's incremental donations raised. And then the other way that we kind of continue to measure the impact is the one requirement of a researcher, again, because Consano doesn't take a percentage of the donations raised for their project, they're required to provide quarterly updates to their donor pool, which they can either publish publicly on their project page, or they can just email out to the people who have donated to their project. And those are not intended necessarily to be formalized, grant review updates, but a conversation with people that, again, would otherwise probably not have access. And I can tell you, on a personal level, it was pretty powerful for me to talk to one of the experts in genetic breast cancer and have her recommend several articles to read. And I had that access because I was creating this organization, but as I was having those types of experiences, I knew that, the 40 women that sit in my young breast cancer survivor support group would love to read those articles too, and to have that kind of voice in their own personal experience. So we definitely fall in very much in the middle of John's chart in terms of the impact. But again, transparency drives all of our decisions. And so, recognizing that people really measured the value for themselves in terms of choosing to donate in a different way, and providing all the information that we can for them to measure that value in their own way.
Can I ask a follow-up on that? Are you going to take a role in vetting and re-vetting who gets to be on your platform over time? Because I have a son with type 1 diabetes, and so we've seen over time there are these researchers who pursue the same failing strategy over and over and over again, but they're really good marketers.
Yes.
And so part of the true outcomes are they actually pursuing solutions that might work?
You hit the nail on the head for my concerns in creating a crowdfunding platform, because as we know, you hear stories of fraud, and all I could think about, I literally see the faces of women I know, because again, breast cancer is my community, but this applies to any disease category, who are literally, sitting there with stage 4 metastatic disease, and these research projects are life and death. So my biggest concern was that some, researcher in their basement would be like, hey, I cured cancer, can I list it on your platform? And so from day one, the vetting process has been ultimately, that's like one of our priorities. So that's why we work directly with the academic institutions to at least legitimize and get the appropriate credentialing that these people are who they say they are. But we also have a scientific advisory board that reviews every project as well, to ensure that not only is it feasible, but that it has, from what we know at the time, the potential to impact patient care. And that really, I think it's also an education process for the public, because to your point, a lot of times the wrong answer is just as important as the right answer. So while, we hope that someone who's undertaking a certain way of trying to cure something is successful, knowing that they're not successful is really important. So to your point,
they're transparent.
exactly, which is hard in academia, because there's not a lot of incentive to make those types of findings public. So we're hoping to help with that as kind of an offshoot of what we're doing.
Thank you, Molly. Since we only have a few minutes left, I don't know what's wrong with the microphone. We're only going to take one more question, and that's for Tara. Since your customers are primarily in India, do you go for U.S. source funding or India source?
So far, we've looked at Indian source funding, but I think when we get to the point where we want to scale, we have to consider funding from all over. Yeah. So I think certainly we will look at funding from the U.S. as well, when we're looking at scaling.
Thank you.
Yeah.
Okay, great.
All right.
Let's go off that way.
Thank you so much.
Oh yeah.